I'm Dr. Monisha. Welcome to One Question at a Time series. Let's move on to today's question. During walking, gravity tends to tilt pelvis and trunk to the unsupported side. What is the major factor in preventing this unwanted movement? Okay? What, in other words, they are asking you, okay, gravity tends to tilt pelvis and trunk to the unsupported side, okay, but that doesn't happen. So what is the factor that is preventing this unwanted movement, or in other words, what is the factor that gives us a stability during walking? What is the factor that gives us a stability during walking? That is the question. Is it the adductor group of muscles, or is it the quadriceps, or is it the gluteus maximus, or it is the gluteus medius and minimus? Okay, we'll see about that. Coming to the adductor group of muscles, we have the gracilis, okay, adductor magnus, adductor longus, brevis and magnus. Okay, we have the gracilis and the adductor group of muscles, all of which causes adduction at the hip joint. Any amount of adduction is not going to contribute to the stability. Okay, is not going to give stability. No stability is given, any amount of adduction. Okay, so gracilis or any other adductor muscles causes adduction, and adduction doesn't contribute to the stability. Coming to the quadriceps, we have the four muscles as the name implies. We have the rectus femoris, vastus medialis, vastus lateralis and vastus intermedius. Okay, so we have the four muscles, all of which gets inserted to the base of the patella, which in turn gets inserted into the tibial tuberosity through ligamentum patellae. So what is the function of the quadriceps? The function of the quadriceps is to cause extension of the knee joint. Okay, the function of the quadriceps is to cause extension of the knee joint. So extension of the knee joint, though it may help in walking, it doesn't contribute to the stability. So what about this gluteus maximus, the third option? The gluteus maximus gets inserted to the gluteal tuberosity, or the gluteus tuberosity itself has become a tuberosity because of the insertion of this powerful muscle gluteus maximus. But from the gluteal tuberosity there is an extension and insertion into the iliotibial tract, which is going to cross the hip joint. So what is its function? Its function is the extension of the hip joint, or in other words, it helps in standing erect. It helps in getting up from sitting position to standing position. It helps in walking, but doesn't contribute to the stability as such. Coming to the fourth option, the gluteus medius and minimus. So the gluteus medius and minimus, both of which lying under cover of the gluteus maximus, gets its insertion into the greater trochanter. A rough insertion into the greater trochanter that is protected by means of bursa, each one for the gluteus medius and one for the minimus. We have a bursa. Okay, so its insertion into the greater trochanter. So what is its function? Gluteus medius and minimus helps in abduction of the hip joint and a little bit of medial rotation. Okay, in contrast to abduction always helps in the stability of the hip joint. Okay, abduction always helps in the stability of the hip joint. So we have come to the answer a little bit, but let's move on a little bit deeper. Okay, so what happens? What is the function of the gluteus medius and minimus? It is just like a seesaw. Can you see this picture? Okay. So in this picture you can see the girl is in air. The girl is in air, but the boy decides whether the girl should stay in air or the girl should drop down. Okay, it is in the boy, or it is in the hands of the boy. If the boy lets it go, the girl will drop down. If the boy lets it go, the girl will drop down. Or if the boy maintains the strength, the girl continues to stay in air. But it all depends on this guy or the strength of this guy. Okay, so likewise, it is just like the seesaw. Okay, so when a person walks, when the left leg of the person is lifted off the ground, it is the gluteus medius and minimus of the right side to decide whether this side should drop down or should stay in air. Okay, if the right side gluteus medius and minimus is paralyzed, okay, when the left leg is off the ground, it will not be able to support this side, resulting in sagging of the pelvis of this side. And the sign is called the Trendelenburg sign, and the gait is called Trendelenburg's gait, or it is the lurching gait. Okay, so you can see in this picture that the left leg of this person is lifted off the ground, and the right side gluteus medius and minimus is going to support the left side of the pelvis from dropping. Or when it is paralyzed, the left side of the pelvis drops. Okay, so which muscle is tested? Okay, if you have to test for the right side gluteus medius and minimus, the strength of gluteus medius and minimus, you have to ask the patient to lift the left leg and look for it. Or if you are going to check for the left side gluteus medius and minimus, you got to ask the patient to lift his right leg. Okay, so just remember the seesaw. Okay, it is the opposite side that decides whether the other side pelvis should drop down or should stay in air. Okay, so coming back to the question, so which gravity tends to tilt pelvis to the unsupported side? But what is the factor in preventing this unwanted movement? What is the factor that gives the stability to the pelvis during walking? It is the gluteus medius and minimus. Okay, so coming back to the question session, which muscle is called as the custodian of virginity? We saw about adductor group of muscles, we saw about quadriceps, we saw about gluteus maximus, and we saw about gluteus medius and minimus. And in which muscle do we give the intramuscular injections? And one other thing is, when is the gluteus medius and minimus paralyzed? The gluteus medius and minimus is supplied by the superior gluteal nerve. Okay, whereas the gluteus maximus is supplied by the inferior gluteal nerve. Okay, when there is a faulty nerve supply of the superior gluteal nerve, there is paralysis of the gluteus medius and minimus. Okay, comment the answer to these two questions in the comment section. Thank you guys. I would like you to like, share and subscribe to the channel, and also comment the answers in the comment section. Thank you.